Hello there, I'm Dr Phil. Can you guess what we're talking about today? Yes, that's right, bedwetting. Well done. Four things you need to remember about bedwetting. The first is it's very common. The second is nobody does it on purpose, so blaming people is completely pointless, only makes it worse. The third is it nearly always gets better in time. And the fourth is if it's not getting better on its own, there are treatments available so you don't need to suffer in silence. Now, to understand bedwetting, you need to understand where urine comes from. This turkey baster, my kidneys, and my ureter, which is the tube that leads down from the kidneys into the bladder. Henry is my bladder. You don't have to call your bladder Henry, it's entirely optional. In fact, my bladder is called P. Diddy, but Henry is actually the commonest name for a bladder. Normally you have two kidneys. I've only got the one, so I've only got one turkey baster. Only ever baste one turkey at a time. But you could have two kidneys and they're both feeding urine down and waste products into Henry during the day and during the night. Henry fills up, and when Henry feels full, there's a little gate on his nose that opens and urine passes out through your urethra, which is this tube that comes out either through the end of your penis or just above your vagina, depending what sex you are. Okay, so the crucial thing about wetting the bed is learning to get control over Henry's nose. Henry has a gate in his nose, and he should tell your brain when he wants to open that gate. So if you wet the bed at night, it means that Henry has opened his gate without telling you. So the secret is to get the control over Henry's nose, over the gate in Henry's nose. And most people do eventually. You know, a lot of kids wet the bed up to the age of 2, then they gradually learn to get dry during the day. Up to the age of 5, most kids are dry at night, but quite a few aren't. And then about 1 in 100 once you get into your mid-teens are still wetting the bed, so it's a pretty common problem. But because it gets better with time, you don't necessarily need any drug treatment. What you first need to do is to understand it, not to blame anyone, and think of strategies, ways of dealing with it. There are obviously waterproof covers and things that you can get, easy washable mattresses. One of the big panics is often when you want to go and stay away, sleep away for a few nights. And there are a couple of tactics there. You can get yourself a sleeping bag to sleep in, a polyester, something that's easy washable. Wear some pyjamas as well, so if you have an accident you can very quickly wrap everything up, the pyjamas into the sleeping bag and pop them in the wash. Always have your clothes nearby so you can get dressed fairly quickly. Just occasionally, when people are going on a big trip away for a few days, the doctor might prescribe a drug called desmopressin, which sounds very fancy. It just stops the body from producing so much urine at night so the bladder doesn't fill up. But basically you will learn to get control of your bladder in time. Some parents lift their children during the night. There's no evidence that actually reduces bedwetting, but it does reduce the amount of urine that may be left during the night. And another tactic, if things aren't sorting themselves out on their own, is to go to the doctor and ask whether you can use an alarm. There's an excellent charity called ERIC. Look them up on the website, they will tell you about alarms. But basically alarm, the little alarm bit, the sensor is worn on your pants, and then you wear a little alarm in your pyjamas, and you can get one that makes a noise, you can get one that vibrates, and if there's a little bit of wetness on the sensor, it will set the alarm off, and that will make you get up and wet the bed. And stop you wetting the bed. Other things that you can do is to drink quite a bit of water during the day. Sounds as if it's the wrong thing to do, but actually letting your bladder learn how to control volumes of urine is actually a good way of training it. So if you drink plenty during the day, gradually you will learn that sensation of the bladder being full. Because often when you're young, you're in a really deep sleep and you don't actually hear Henry's nose needing to be open. But actually if you drink during the day and you understand what it feels like to need to go to the loo, often that's a good message to tell you to get up. There are other ways you can make it easy. Have a toilet nearby. Make sure there's easy access to get to the toilet. So obviously if you're in bunk beds, you sleep on the bottom bunk. Plenty of other good information on this website, plenty of good information on the ERIC website, and information about me on drphilhammond.com. Thank you for listening. Bye, says Henry.